In cities like Baltimore, the most important indicator of health and life expectancy is your zip code. Racial disparities and chronic health conditions like hypertension and diabetes can be traced back to historically low economic and social investment in predominantly Black communities. According to the Centers for Disease Control, access to early health screenings and primary medical care are crucial for addressing these conditions. Andrew Suggs' experience with his own father's chronic illness led him to transition his company Live Chair Health from a scheduling app for barbers to a convenient way for Black men and women to receive these important screenings and care.
If you have comorbidities and you have to, purchase medication every single month, well, that's money that could be used somewhere else, like a savings account or another bill. And so if this person is paying $80 more per month, right, that's almost $1,000 a year. You compound it over 20, so it starts to add up.
Tell me about the evolution of Live Chair Health to a tool to access healthcare screening and quality healthcare.
I started to research health disparities, and one of the things that we uncovered is the lack of access and the distrust of the medical system or the healthcare system for African American men and women. And so because the healthcare system couldn't reach people that looked like my father, this led to him and others that looked like him having these conditions. And so we wanted to do something about it, and we had an epiphany, and we said, where could we access African American men? And then a light bulb went off, and we said the barbershops that you're serving right now with this platform.
One of the key things for men like your dad is to have these important conversations so that they can identify these emerging illnesses before they get too far down the road.
Yeah, that's exactly right. It's all about access and being more preventative and proactive versus reactive. And so if we can, get someone a blood pressure screening at 29, and they are, hypertension stage 1 or maybe stage 2, and through our program give them the tools and the resources to manage and prevent that from exacerbating, then we will be able to level the playing field in terms of making healthcare more equitable for all people.
Andrew described the importance of these trusted barber chair conversations that have grown right alongside the barber's historic role as an entrepreneur in Black communities.
Not too many people do you allow in your personal space besides your significant other, maybe your child, and your grandmother, of course, and your barber or your minister. And so it's a personal space, and giving people or a person that proximity over a number of years, that really builds the trust and the confidence that one has in sharing information with that person.
The fact that Black men are willing to rely on their barbers for medical information comes from over a century of exploitation and abuse of Blacks at the hands of the white medical and political establishment. In 1932, the U.S. Public Health Service misled 600 poor Black men around Tuskegee, Alabama, to enroll them without their full informed consent into a study to examine the effects of untreated syphilis. For 40 years, researchers withheld treatment for the disease even after the advent of penicillin to treat syphilis in the 1940s. 28 men died, and countless other wives and children were infected until the Washington Post exposed the study in 1972.
Because of that distrust, you have the adoption of wrong information or misinformation. And because of that wrong information, you have people that are actually getting their health care from a barbershop or a salon or their community versus the institutions that were built to provide care for folks.
Baltimore was among the cities at the center of terrorizing stories of night doctors who would kidnap and confine Black people for use in covert research studies. In 1951, Johns Hopkins University Hospital took living cells from Black cancer patient Henrietta Lacks without her consent or compensation to create the first reproducible human cell line that researchers and companies still use today.
Because they trust us, when our platform, our staff is in the shop, we're rebuilding that credibility for the health system to come in and kind of do their job.
And one of the great things about Live Chair Health is there's also a benefit for the barbers and the stylists that participate as well.
We reward the barbers for each client that enrolls into the program. We also reward the barbers for taking blood pressure readings or encouraging them to go see their primary care doctor or getting a vaccine or a flu shot.
How does Live Chair Health involve healthcare providers in what they do?
We're standing here on the beautiful campus of LifeBridge Health, who actually was our first partner when we made a pivot into healthcare. One of the things that we emphasize is free screenings. It takes about 45 to 60 seconds, and it gives someone a tangible number to take back in action. And so a client can enroll into the free Live Chair Health program through a QR code. And so when the barbers and the stylists are communicating to their clients about the providers that are in our network, we basically get a stamp of approval. We are acting as that bridge from community to clinic, because for a lot of them, it's the first time that they're coming back into the system. I mean, we've met people that hadn't seen their primary care provider or provider at all for 5, 7, 8 years.
What message would you want to give to students that are considering an entrepreneurial endeavor or starting their own company?
Yeah, I would say number one, count the costs, because you have to have the intestinal fortitude to withstand the blows that come with being an entrepreneur. So really evaluate if you want to be an entrepreneur, and don't get sucked into the glamorization of what you see on the TV, because most companies fail. And so how comfortable are you with failure? How comfortable are you living in the unknown day to day, right? So count the costs. And then number two, if you do plan to be an entrepreneur, we're talking about black founders, if you don't come from a safety net like I didn't, you really have to save. So save, because at some point you're not going to be able to work a corporate job or work a job and really go 100% at your vision with split attention.
Tell me what it's like being a black founder going into the funding market to support not only a black entrepreneur but also a socially minded venture.
Yeah, so there are, I think, a lot of black founders don't get the benefit of the doubt like our other counterpart, or the general population. And so as an example, I have a friend in venture, and he told me, hey, I've seen a couple deals lately where this company, they don't even have a product. They just have a wireframe, and they got $5 million. And here I am with 4 of the largest health plans in the United States, traction, product, and it's like people are still saying, well, you don't have this. Well, yeah, but every other company doesn't have this at this stage as well, but you still give them X amount of money. So not only do you not get the funding, but it just starts to eat at your psyche, like, am I gonna make it? Outside of the funding, I think the team is so important because if you're marching in one direction and someone wants to march in a different direction, that's gonna cause friction. So making sure everyone is playing to the same sheet of music and everyone knows where that North Star is.
What is it that institutions like Loyola can teach their students and their network to create a cohort of funders that are empathetic and can be true partners with founders like you in the work that you're doing?
I think just respecting the humanity and people that don't look like you. I think that's number one, and realize that there is, from a financial, purely economic perspective, there is money to be made in our industries, right? Not just what we're doing, but in other black and brown communities, because there's a lot of problems. And anytime there's a lot of problems, there are solutions, and solutions are normally monetized, right? And so I think, one, respecting the humanity and someone who doesn't look like you, understanding their experience, being more empathetic, and then really giving honest feedback. And so there's a message that's conveyed that's like, oh, okay, you do this. But then when you do that, then it's like, oh, no, you need to do this. And then when you do that, it's like, oh, well, we passed for some reason that they just are saying to not, look bad.
So it's not so much that the bar is higher, but the bar keeps changing.
It keeps changing. The goalpost keeps moving. And so, where do we need to be, right? Like, where do we need to be? What metrics do we need to hit in order to unlock that funding? So, are we about just like sound bites and sending nice emails that make us feel good?
Checking the box.
Right. Or do we actually want to say, okay, this is a company that's comparable to this company. why did I give this company $10 million and I gave that person $250,000? Like why? What's the reason for that?
Andrew concluded by describing a vision for Live Chair Health that keeps him motivated every day.
Just because of our presence in the shop or being more mindful about their health, that's a win for us. And so in 5 years, I would like us to put a dent in some of the health disparities, specifically around hypertension first, and then as we continue to grow as a business and organization, other chronic diseases. And then from just a business growth standpoint, we want to expand our reach to other markets. That's what keeps me motivated.